All right, let's jump right in. When you think about treating a sick kid, it's so easy to just assume it's like adult medicine, only smaller, right? Smaller doses, smaller equipment. But the truth is, caring for children is a whole different universe, and it's governed by this unique set of unwritten rules that go way beyond just body size.
So that's the big question, isn't it? Why aren't they just miniature adults? And that's really what this whole explainer is about. It's because everything is different: their bodies, their minds, and their legal standing in the world. And getting a handle on these differences, well, that's the absolute key to giving care that's not just effective, but also kind and ethical.
To get our heads around this, we're going to break it down into 4 core rules. First up, asking the right person. Who actually gets to say yes or no? Second, seeing through their eyes. How do we even begin to understand what a child is really going through? Third, a duty to protect. What happens when a doctor's duty to the child clashes with what a parent wants? And finally, number 4, caring for the caregivers. Because as we'll see, you can't really care for a child without caring for their whole family.
Okay, let's start with the absolute foundation of any medical care: permission. Rule number 1 is all about making sure you're asking the right person. And this all kicks off with a critical legal concept called informed consent.
Now, you gotta understand, informed consent is so much more than just getting a signature on a piece of paper. It's a whole process. It's a conversation. It's making absolutely sure that the person making the call truly gets what they're agreeing to. The good, the bad, all the other options. It's all about protecting a patient's right to choose. So for a child, who holds that power? Well, there's a pretty clear legal pecking order. It starts with the parents, biological or adoptive. After that, it's any legal guardians who've been appointed by a court. In some cases, it might be a foster parent or even a representative from the state. And then you have this interesting category: emancipated minors, basically teenagers who a court has legally recognized as adults. But, and this is a big but, here's where it gets a little more complex. The law gets that in certain, let's say, sensitive situations, forcing a teen to tell their parents could actually stop them from getting help they desperately need. So the rules have some really important exceptions built in. And these are often called medically emancipated conditions. In most places, this means a minor can legally consent for their own care when it comes to things like birth control, STIs, pregnancy, substance use, and mental health services. The goal here is simple. It's about protecting their privacy and knocking down barriers so they can get help without being afraid. And there's another really important layer to this. While a parent or guardian gives legal consent, we also look for assent from the child. What's that? Well, starting around age 7 or so, we explain things in a way they can understand, and we ask for their agreement. Now, it doesn't legally override the parent's consent, but what it does is respect the child as a person. It brings them into the conversation about their own body. So we ask the parent, but we always involve the child. Okay, so knowing who to ask, that's the legal piece of the puzzle. But rule number 2, this is where we get into the real art of pediatrics. Actually trying to see the world, and especially something like pain, through a child's eyes. And that means you have to understand how they think. And a great way to do that is to look at the work of the psychologist Jean Piaget. He laid out these 4 big stages of how our brains develop, and it's like a roadmap to a child's mind. From being a tiny baby who learns through their senses, all the way up to an adolescent who can think in the abstract, each stage is running on a totally different mental operating system. And this is where it gets absolutely fascinating. These cognitive stages completely change how a child experiences and expresses pain. A little kid, like a preschooler, might use magical thinking and believe a needle is punishment for being naughty. A school-aged kid, they get cause and effect, but their biggest fear might be losing control. Then you get to teenagers who might hide how much they're hurting just to seem strong. The bottom line is, you can't treat their pain if you don't get how they see it. Which of course brings up a huge question. How in the world do you measure pain in someone who can't use words, like a baby or a nonverbal child? You can't just ask them to rate it from 1 to 10. So healthcare providers have to become detectives. And one of their most important tools is something called the FLACC scale, FLACC. It's a clever way to measure pain just by observing. Clinicians look at 5 things and score each one. What's the child's face doing? How are their legs positioned? What's their activity level? What does their cry sound like? And how easily can you console them? By adding up those scores, they get a really reliable picture of just how much pain that child is in. This all leads us to our third and maybe the most serious rule of all. Sometimes a healthcare provider's #1 responsibility isn't to the parent, It's directly to the child. This is their fundamental duty to protect. You see this most clearly in an emergency. If a child's life or a limb is on the line and you can't reach a parent, providers don't just stand there and wait. The legal idea of implied consent kicks in, which lets them act right away. Basically, the law assumes that any reasonable parent would absolutely want them to do whatever it takes to save their child's life. But what about that gut-wrenching situation where a parent is there, but they refuse life-saving care, maybe because of personal or religious beliefs? In those awful moments, the medical team's duty is crystal clear. The principle of acting in the best interest of the child takes over, and they can even get a court order to give the treatment. The child's safety has to come first, period. And this duty to protect extends even further into the really tough territory of potential abuse and neglect. Healthcare professionals are what's called mandated reporters, and this is a legal obligation. It means if they have a reasonable suspicion, and notice I said suspicion, not proof, that a child is being harmed, they are required by law to report it to authorities like Child Protective Services. And they're trained to look for very specific red flags. Things like stories that just don't add up with the injury, or seeing bruises that are all in different stages of healing, which could suggest ongoing harm. Maybe it's parents who waited way too long to get help for something really serious, or a child who just seems incredibly fearful or shut down. These are all little puzzle pieces that can point to a child who's in serious danger. Okay, so we've covered the law, we've gone inside the child's mind, and we've talked about that serious duty to protect. But our final rule kind of zooms the camera out, because you can't really care for a child in a bubble. You absolutely have to care for their caregivers too. And this really gets to the heart of it. A child's health is completely tied to the well-being of their family. A parent who is stressed out, exhausted, and feeling totally alone just can't be the strong advocate that their sick child needs them to be. The family isn't on the sidelines, they are a core part of the care team. That's why good providers are also keeping an eye out for signs of caregiver burnout. Things like constant exhaustion, being really irritable, pulling away from friends and family, or just completely neglecting their own health. Spotting this and helping with it is a huge part of pediatric care, because a supported caregiver is one who can better manage all the appointments, give the medications, and provide that stable, loving home a kid needs to get better. So we've walked through it all. The legal stuff, the developmental science, the really heavy ethical duties. We've seen how consent and cognition and family are all these crucial pillars. But when you boil it all down, after all of that, what is the one single thread that ties it all together? What's the most important principle of all? It's just one word: empathy. The ability to really listen, to validate how someone is feeling without judgment, and to genuinely try to understand what it's like to be in the shoes of both that child and their family. It's the foundation that all these other rules are built on. Because at the end of the day, pediatric medicine isn't about treating a disease. It's about caring for a person.